So one thing that can happen in the recovery room that's very common, but it is not a complication, but it's important to understand, is the very first time that your nurse gets you up out of your stretcher after you've had joint replacement, is your blood pressure may drop. If that happens, it's very common to feel dizzy, and your nurse will help you lay back down, give you some fluids or some crackers or something to eat with salt. And usually the next time she tries to get you up, everything's fine. But in some instances, it takes several attempts to get you up out of the stretcher before your blood pressure cooperates. And again, this is very common. It happens to many, many people, and it doesn't mean that there's been a complication. But your nurse knows what to look for, and physical therapy knows what to look for, and they're not going to get you up too early. They're going to wait till your body is ready so that you're safe.